somehow fits in between the intracorneal rings and bulk. And I think this is a very promising, innovative surgical method. The two main aims of keratoconus surgery are to stabilize the cornea and to improve the vision. And you see such a lenticle implanted into the corneal stroma on the OCT picture here. And by this lenticle, we can achieve both aims, to stabilize and to improve the vision. So let's have a look at the video. So this is the video, how we start to prepare the patient and create a pocket in the cornea of the patient. So we use a femtosecond laser for that. So you dock the patient, you center your treatment zone, and as soon as everything is ready, you push the foot switch of the femtosecond laser, and we create such a pocket, which is typically 9 millimeter wide. And you also create a tunnel incision to enter the pocket. We typically perform this top pocket 200 microns deep. You've seen that the laser was pulled away because it's a mobile laser, and by means of 2 spatulas we just open this pocket to get it ready to receive the lenticle. And the next case is the laser cataract surgery through an opaque cornea. And opaque cornea poses a significant risk for cataract surgery and is often cited as a contraindication for flax. And this video shows that it is really possible to perform flax through a significantly opaque and vascularized cornea. And for this case, we have a cornea like that with a white cataract behind it. So let's move over to video. So of course, every surgeon understands the risk of such an eye, and as this eye was not really suitable for transplantation, and despite its limitations in visual potential, this white cataract is the most significant problem of this eye. So we did the femtosecond laser, then I used the trypan blue to better visualize the anterior capsule, which is not routine, of course, for flax. So we see that we have cut through the capsula because you see the white material in the chamber. So now we perform the main incision and cover the eye with OVD, and also, of course, fill the inside of the eye with a little bit of OVD. And now I'm very careful to start the procedure. I aspirate the central capsula, which I usually do only with a phaco tip, but here also for the purpose of demonstration I decided to take out this central capsula cut by a femtosecond laser out of the eye to observe this capsula and to verify the quality of laser capsulotomy through this really challenging cornea. And let's move over to the next point, which will be the plasma generators for oculoplastic surgery, which is quite exciting and fast developing field. And the plasma generators are electric devices producing plasma discharge, which causes sublimation, electrocoagulation, or carbonization of the tissue. It works without tissue contact, it's bloodless, effective with minimal risks, and that's kind of alternative for electrocauter or lasers. And they are also suitable for in-office procedures, which is, I believe, pretty significant. There is a list of indications. I think you see the whole plethora of different indications, which we do not really need to go through all of them. So here follows some pictures after treatment. So upper eyelids immediately after treatment for blepharoplasty, and the lower eyelids immediately after treatment, and you have the molluscum after treatment here, and it can be even used on the conjunctiva. So this is a smaller pterygium immediately after treatment, and we have a conjunctival cysts before the treatment and after the treatment. So those devices have quite wide range of applications. So we have the question, what are the main advantages of those plasma generators? Barbara.
Thank you. I feel that that hand piece which you are holding as the ophthalmology device, it's quite small and you can easily manipulate with it. So you can easily do the tiny little surgical, surgical things around the eyelids, on the margins of the eyelids, where you've been not able to use any device before for that. As well, that you can see the results immediately after you've done that kind of treatment. There's unbleeding procedure. It's quite safe if you're not, I don't know, by mistake touch the cornea, which usually not happen if you use some like a plastic or PMMA shield, which you can put on the cornea during that procedure, during that treatment. And if you very well indicate patient for those kind of indications, which you've already mentioned them, the results are really nice after them. So I feel that this is the main reason why we should think about using this plasma device more often for things which patients when are quite, let's say, scared about going under the normal surgery, bleeding surgery, or patients who are under some anticoagulate treatment or who are, I don't know, not suitable for any other treatment. They're quite suitable for this one. I want to make some few comments about that video which we just saw. That plasma beam is basically like it's one of those devices which are producing not like solid, not the liquid, not the gas, but the plasma, which is like a fourth stage of one of those materials. Thank you. And the very fantastic about this material is that it's not making any scars. If you're not leaving that plasma beam going too long on the skin, it's just carbonificate, it's not scarificate the skin. So that's basically the principle of making all those plastic kind of oculoplasty surgery can be done without, without bleeding, without making scars. Thank you.
Yeah, thank you very much. And because the thermal damage doesn't really dissipate far away from that spot, it can also be used on the conjunctiva, which was clearly shown, and I think that's another very important potential application of those devices. So I think we have a potential new field of indications, because some of those conjunctival lesions, it's difficult to be surgically removed, and perhaps with those devices we can be less invasive compared to our current methods. So I think that was very interesting, and we are happy to share those plasma generators and experience with them, with our audience in our online discussion. And let's move to the next topic. And that topic is the intensive pulsed light for dry eye treatment and dry eye itself. And this is just a list of basic methods which we usually take into account at our clinics for dry eye, and we will go just point by point through them. So of course we usually start with the artificial tear eye drops, and those artificial tear eye drops should be preferably preservative free, based on hyaluronic acid, and the tolerance should be individually tested, so that it's not like one drops which is the best one and the other one which is second, but the patient quite often needs to test on herself or himself which one is the best choice for them. So autologous plasma teardrops, I think it's a really great tool, and we use it quite frequently. They are made from patients' own blood. There are some legal barriers in some countries, including the Czech Republic. And there is a plasma-rich growth factors, which is an industry backed solution to get this plasma drops of even higher efficiency. So we are testing this Spanish product in clinical practice right now, and it seems like it's also a very good solution. One step which is, I believe, quite unique at our clinic is herbal food supplement for dry eye, which we use pretty commonly, and we have developed our own formulation, which is called Ophthalmology Herbal. It's made purely from herbs, and one capsule is taken orally a day, and usually quite soon this can improve both the quantity but mainly the quality of tears, and patients really, it's really quite successful among our patients. So if we look at the end of the list, we have the meibomian gland expression, which is certainly an important part, but it's been very well also used together with intensive pulsed light therapy and plasma generators. For some of the more severe cases, we use the silicone oil drops, and even we have a very, very positive experience with acupuncture and homeopathy, and of course air humidifiers are part of the dry eye therapy also. So let's have a look at the video. So this is the intensive light, pulsed light therapy. So we protect the eyes with the shelves, which are part of the treatment kit from the manufacturer. This is a device called EI, manufactured in France. You switch it on. This is how we adjust the energy. It's not the battery, it's the energy. You go through the menu, and the personnel is advised to use protective goggles. And this is the handpiece with a flashing light, which gets into the contact with the patient's skin through a gel, which was applied over the cheekbones and temporal area, and then you push the switch and apply the pulses of the light. So I think the video quite clearly demonstrates this treatment, and our initial experience with that treatment is also very promising. That's why we decided to share that with you at our discussion today. So do you use both plasma generators and intensive pulsed light therapy for dry eye treatment, Anna?
We use mainly IPL because it's less invasive than a procedure with plasma generator, but we have one patient whom we treated with plasma generator. He had chronic blepharitis, and we combined with autologous serum drops, and we achieved promising results.
Okay, thank you very much. So yes, we need to look at those patients from different perspectives, and not every dry eye has the same cause, and maybe the treatment approaches might also vary. So thank you for that, Barbara.
Thank you. We are using mainly the plasma generator because with the IPL you are not able to reach the meibomian glands on the upper eyelid. That's the main trouble. Another one is you can go immediately to the origins of the meibomian glands with the plasma device, which with the IPL you are not able to treat on the margins of the eyelids, where the main blockage is basically what it is. So we're using mostly the plasma one.
Yes, I think we need to find out which method and in which patient also, and we still need some time for that. From manufacturer recommendations, it's possible to use the IPL also on the upper lids. You anesthetize the eye and put some covers there. We haven't done that yet. The plasma generators work more on the eyelid just Marco, and I think you can more open the glands there. With the IPL, we believe we maybe more stimulate the nerves leading to the glands to produce. So I think there is quite a lot of theories around us, and we will find out. I, at the beginning, personally was quite skeptical about the IPL because I said, well, you know, why that light improves anything, but it really seems that our experience is very positive, so I think probably both methods will find their way through.
Thank you for that, but we've got a really good experience now. We've got few patients which after 2-3 months, of course, they've been advised to use all those drops which they used before, those artificial tears, do all those massage of the eyelids, but after 2-3 months, few of them do not have that severe problems as they've got in the very beginning, which I believe after IPL, the results are not that good. Plus, you can see the results after using the plasma device immediately after the procedure, not like after IPL. Plus, we believe that the plasma also, when you're doing like up and down like not dot by dot, but stimulation of the meibomian glands on the lower and upper eyelid when you do the elevation, trying to turn the upper eyelid or lower lid, avert them. Thank you. And you can stimulate those meibomian glands to like make that pus not that stuck in there, so it like more liquefied, and it also stimulated to like to work more, to like make that discharge better. And we can see it also on the meibomiangraphies, which is quite nice method how to check how the meibomian glands are stimulated by that plasma, and the results are quite nice.
Barbara, what about the contraindications of both methods? Can you just name some of them, please?
Of course, so it's a plasma, so electric device. So people who's got pacemakers, who's got some heart troubles, who's got some implants somewhere, all around that area where we are using that plasma device, or all around the rest of the body. Oncological diseases, some active disease in the body, I mean like inflammation or infection, all those are for both methods, for IPL and also for plasma, are the contraindications. But the IPL's got more contraindications than the plasma JETT, because you have to also think about what the light will create on the skin, so all those skin troubles, lentigo maligna or lentigo, all the troubles with the skin in general are the contraindications for IPL, which are not for the plasma device. And pregnancy as well, and breastfeeding as well for both. So, yeah.
I think the main contraindication which we should keep in mind for IPL are the pigmented lesions on the skin, so we can sometimes cover them. Typically, if someone has tattoo, it's a contraindication, or at least it's a significant danger, because the skin can be heated too much. Also, the history of sunburns during the last 4 weeks, things like that. So also the medications which cause tanning of the skin, or the creams with tanning. So we need to understand those basic indications and contraindications for both methods. And I think we need to find a way through it, and maybe the methods are also quite complementary. For IPL, typically we need 3, 4 to 5 sessions. How long does it typically take to receive the subjective improvement from those patients, Anna?
Well, it really depends on the severity of patient's symptoms because patients with mild eye dryness can benefit from 2 sessions, while patients with higher severity may need 4 to 5 sessions.
Okay, yeah, thank you very much. So I think that was a very nice discussion. Once again, I'm going to show the overview of those treatment methods for dry eye. And Peter, do you think we see dry eye as a rising problem in population?
Yes, I think it is so. We see a lot of patients with this problem, especially after or previous cataract, before cataract surgery. So I think this group is relatively common to be affected. So yes, we see a lot of them. And it is sometimes very severe problem for both, for doctor and for patient too.
Thank you very much.